Welcome everybody, this is me, Dr. Riham Shade, an obstetric and gynecological specialist, and today we will answer your great questions, which is one of the most important questions you could ever ask us, and you are repeating it all over the time. Is your menstrual period in its irregular form dangerous for your health and for your fertility future, or this is something completely normal and you could ever not to do anything for that? We will answer you for what is the causes of your irregular period and how to make this irregular period to be a regular period again, and to regain your fertility and regain your health. In the next few minutes we will have all of these answers, but before doing that, don't forget to subscribe to our channel and to make sure that you hit the like button to be able to get all the notifications in the future of the videos we are uploading in this channel. Before we understand all of these aspects, we should have this acknowledgement. This is something about your menstrual period. Your menstrual period, on the average time, it's 28 days, and we have the first half of your period and the second half of your period. In this first half of your period, you have an estrogen, a complete dominance of estrogen hormone, and in your second part and your second half of your period, you have the predomination of progesterone hormone. So you have two hormones alternating with each other, and so it could makes you to have a regular menstruation, and in between them you have what we call ovulation. So what is the causes which could affect the alteration of these hormones? It's something which is very important, in which there is abnormality in the hormonal balance of estrogen and progesterone, and in which cases we will have what we call an irregular period. The first cause of this irregular menstruation is something which is very important, and it's very common as to is something about polycystic ovarian syndrome, in which we have what we call a predominance of progesterone, and in which you don't have what we call ovulation. You have irregular ovulation, and so you have also an irregular period. But there is a very rare cases in which we have a regular menstruation, but we don't have an ovulation, or we have a weak ovulation, and this is a very regular cases in which they have regular period, but they don't have fertility, or they have weak chances for fertility. So they should undergo what we call ultrasound and investigation, and complete investigation for what we call polycystic ovarian syndrome, and we have a complete video about that, and we have explained everything about PCO in the medical point of view. The third cause in this situation, we have what we called a very weak AMH, or what we called Antimullerian hormone, which is the ovarian reserve of your ovaries. And in this situation, you have a very low ovarian reserve of follicles, and in this time, you have what we called a very weak hormonal effect of your ovary. And this very weak hormonal effect would affect as to the endometrial lining and the content of your menstrual period and the content of blood which is in your uterine cavity, and so you have what we call the spotting, or an irregular spotting. And in this situation, you would ask yourself, what is this? And you think that this is your menstruation, and this is not your menstruation. This is something which is happening due to the weak effect of these hormones, which can support the endometrial lining, and so can support the whole time until we have what we call menstrual bleeding. So this is one of the most important causes, and you should understand that, and you should take care about having investigation of your Antimullerian hormone. And when we return back for one of the most important causes of this irregular menstruation, which is stress factors. You may be unbelieving for that, and you should understand these steps to be able to understand how stress would affect your fertility and would affect your chances of getting pregnant. So let's start. We have in our brain what we call the hypothalamus, which is affecting and which stimulates the pituitary gland, and the pituitary gland would stimulate the ovaries by follicular stimulating hormone and luteinizing hormone. by these two hormones, we stimulate the ovaries to secrete what we have already before, which is estrogen and progesterone balance. So if we have any disturbance in this axis, we will have what we call fertility and ovulation, and a disturbance on hormonal balance between estrogen and progesterone. So please, we are need just to remove all of this stress from the hypothalamus gland, so we would have this balance and this right pathway between this pituitary and the ovaries as two. So we have a good fertility and we have everything about it. And you have a lot of examples of people who was very stressed about getting pregnant, and she is doing her pregnancy test every day, every month, and she is very stressed, and the surrounding also are very stressed. But the time where she get pregnant, it was the time when she makes her ideas completely away and makes her thinking completely away from asking and searching about pregnancy, because she have removed the stress from her pituitary and her hypothalamus, and so she enjoyed what we called a normal axis response between these hormones, and so she gets a hormonal balance and she gets ovulation, and as a result she gets pregnant. Also, one of the major factors, which is the hormonal drugs. The hormonal drugs we are taking to regulate our menstruation, to make our menses, to have a menstruation where we are gonna to enjoy time, and we don't want to have menstruation in this time, and this is the time of your period as to. So this is hormonal drugs in which we are in need to take it in a great balance. But if you take it in a disturbed way or irregular way, so you will get what we called irregular menstruation, because you make the artificial imbalance between your estrogen and progesterone hormone, and in this situation you have this irregular period. But how we could help that, and what these things would affect those people who are taking these drugs in a regular way? Yes, we would explain that by, if you take this drug and you get vomiting or you get diarrhea, or you're taking antibiotics or something like that, you would increase the effect of these drugs on your body, and so you are in a case which is similar to having no drugs in this day, and so you get this imbalance between your hormones, which is estrogen and progesterone hormone. And in this situation, we have what we call irregular menstruation. So take care about that and make sure that you are taking all of these drugs in a separate and in an actual time and in a definite time, and you don't make it in any imbalance, so you are enjoying your regular menstruation. Examples of these drugs, which is oral contraceptive pills, or some of the drugs we are taking just to delay menstruation or to make it to go away before its actual time. This is some sorts and some examples of these hormonal drugs. So take care about these drugs, and never forget to ask your doctors before taking it, and because this is a very dangerous drug for your fertility balance. Also, one of the most important and very common factors which could affect your menstrual regularity is the age. In early menarche, and in the time of your first period at the age of 12, between the age of 12 and 16 years old, this is the time of irregular menstruation. The first 1 and 2 years of your menstrual cycle age, this is the time of irregularity, because this is something which is normal and completely normal. As a doctors, we don't write any drugs for that, and we ask the patient just to follow up her menstruation, and if this is something which is repeated, which is happening, it is repeated for her next year, this is something which we are in need to understand and we need to investigate. But if this happened only during her first year of giving and having her menstrual cycle, this is not the major medical issue, and we don't care about that. And so in the extreme of age, in the extreme of your fertility, in the end of your fertility, when you are reaching the age between 40 and 55 in some people, and it may increase or it may be more earlier, it's the time in which you get your menopause. This is a time of very great irregular menstruation, and you could expect that. And as a doctors also, we also only make you to assure you just this is something which is completely normal. So don't be astonished by this irregularity and the extremity of your fertility age, and make sure that you are just not taking any other drugs or any other things. Also, one of the most common factors for this irregularity is having what we call fibroid or uterine polyp or something like that. Fibroid is what we call tumor, a benign tumor of the uterine muscle wall. It may affect a lot of parts and in many different ways, but one of the most important symptoms of these fibroids is bleeding. This could affect the duration of your menstruation, of your period, and could affect also the time of your menstruation. It may increase the duration from 5 to 10 days ever, and it could affect also the time of this menstruation, in which this is not a menstruation. This is just a bleeding from this uterine fibroid, and you should make sure that this is not your complete signs and symptoms of your menstruation. This is just a bleeding, just completely different. And also there is what we call uterine polyp, in which we have an extra tissue which is bulging from the endometrium, and it causes fragility of these blood vessels which is coming in, and it causes spotting and bleeding in different times, which would makes you to be unsure if this is your menstruation or this is a bleeding or something like that. So this is something which we could get investigated, and we could have our complete investigation and medical examination to understand and to tell you this diagnosis. And finally, one of the most rare causes which could ever happen, which is ovarian tumor. We call the ovary is the operating room. This is something which is the major and the master of all these hormones which could affect your fertility. But if this organ could be affected by a tumor, this is something which would affect the performance of this ovary, and also would affect the secretion and the balance between these two hormones, between progesterone and estrogen hormone, and so would affect your fertility in a great way, and also would affect the regularity of your menstruation. And this is something which we are seeing as a doctor in our clinics, and it's something very rare, so don't make it the first choice for you and the first expectation for you, because this is a very, very rare situation. And one of the most common cases is just polycystic ovarian syndrome. One of the most common cases is stress and anxiety or something like that. So don't be stressed and make yourself to be, oh my God, this is something which is great for me. Oh no, this is not the right thing. This is inshallah something very, very normal and not affecting your health. And finally, this is our take-home message. You should understand that we have this organic causes and we have this functional causes of menstrual irregularity, and we get from all these causes a conclusion that this is not something which is very dangerous in your health, and this is not something you should be anxious and should be terrified from. This is something which is happening and it's normal. And as a doctor, I should have these steps for diagnosis. I should have the steps for ultrasound to diagnose what we called an organic causes, which is ovarian tumor or fibroid or uterine polyp. This is something which is very important, and I should do what we call investigations, which is very important, lab investigations or something like that, to get diagnosis about your functional causes, which is polycystic ovary, your hormonal imbalance, your drug which you are taking by your history, medical history, or something like that. And finally, you shouldn't get out of the clinic before you understand what is the causes if you have all of these investigations and laboratory diagnosis. So we are hope you all of the best. If you make sure and understand these points, please tell us that and hit the like button, because this is something which could encourage us to do more videos and explain more of these medical issues. And you can follow us on any of these platforms, on Facebook, on Instagram, on any of these platforms, which would help you. And also you can get many of our courses which is found on Udemy or any other sites. Wish you all of the best of your health. This was me, Dr. Hamshel, obstetric and gynecological specialist. Don't forget to subscribe to get the next lessons.